I'm talking about stem cells. Now, we hear about stem cells during childbirth when the doctors tell you or give you an option whether you want to store the stem cells of your newborn baby, which is a really good idea. We hear about stem cell treatments when it comes to some complicated cancers, certain issues of the joints and hips and all of that stuff. That's where our knowledge ends with stem cells. But do you know that each and every one of us are built up of stem cells? Our immune system, for it to be efficient, is dependent on stem cells. So everyone's talking about immunity, all of that. That's great. Okay, but underlying immunity is something called stem cells. And we are made up of stem cells. Ever figured what grows and maintains your organs? Stem cells. Your liver is a collection of stem cells, your eyes, your hair, your skin, your heart. Every single organ in the human body is made up of stem cells. In fact, when the sperm and the egg meet together, it's a beautiful symphony of stem cells and angiogenesis that takes care of forming the fetus. So you see, we already consist of stem cells. And now let me give you a simple example of what happens. These stem cells are stored in the bones. And when the immune system gives a signal, all of these stem cells swarm out of your bone marrow like bees rushing to the spot that needs repair. So if I have damage in my lungs right now, what's going to repair it? Stem cells. If I have damage in my heart or my endothelial linings, like I have too much of plaque or too much of bad cholesterol, I'm going through a heart attack or a blockage, what's going to repair it? Stem cells. You fall down, you get a wound, what's going to repair it? Stem cells. You have brain damage, or you have damage because of the excess amyloid proteins in the brain that causes Alzheimer's and other brain issues. What's going to repair the damage caused by inflammation? Are stem cells. So now, can we get more of these stem cells, or can we maintain the stem cells that we already have in the body? So stem cells basically help us repair our organs. It is required for repair. You can have the best immune system, but if you don't have the right quality of stem cells, guess what? Your immune system may fight the infection, but you're eventually going to die because you don't have stem cells to repair the damage done to your endothelial cells, your arteries, and everything in the human body. So let me give you an example. Your small intestine basically regenerates every 2 to 4 days. Every 2 to 4 days, it regenerates automatically. Your lungs and your stomach regenerates every 8 days. Your skin regenerates in 2 weeks. Your red blood cells regenerate in about 4 months, which is why you're not allowed to donate blood unless it's after 3 to 4 months. And your immune cells every 7 days. Now, this regeneration can only happen if you have stem cells. So because of your poor lifestyle or some complicated disease that you have, if you cannot produce stem cells the right way, you cannot regenerate any of these things I spoke about. And that becomes the root cause of almost every single condition that we're battling with. So now your stem cells, there is so much of science showing us how food and lifestyles have the ability to regenerate stem cells in your body. All of us think we need to go to a stem cell doctor and all of that stuff. You can, but we have the ability to regenerate. You see, the human body wouldn't have been given to us without an intelligence to basically regenerate stem cells automatically using your food and using your lifestyle. So now let's talk about the things that deplete us of stem cells. When we're born, our stem cells are at its highest. When we're teenagers and young adults, it starts to deplete. As we age, the depletion of stem cells become more and more, which is why recovery from injuries becomes slower and slower. Okay, recovery equals the amount of stem cells that you have. So if you ever look at burn victims, when it's a stage 3 or a stage 4, where the burn has affected the bone marrow, the patient eventually dies rapidly because the damage is done to the stem cells, and the stem cells can no longer repair or protect or support the immune system with that burn victim. So that's a classic example of how stem cells support life every second of the day while we're awake or while we sleep. Athletes need it. Athletes who train and need more muscle consumption or muscle formation require more stem cells. You cannot build more muscle if you have depleted stem cells. So you see, every activity in the body requires stem cells. Now let's go into the lifestyles that basically stun the production of our stem cells or kill or weaken the stem cells that we already have in our body. The number one thing is smoking and passive smoking. You may not smoke, but you may be living with a smoker. Passive smoke is the most dangerous thing that stuns our stem cells. Okay, which means forget about immunity. It is lowering your immunity. But along with immunity, it's stunning your stem cells, which means as the smoke damages you more and more, or you get some other condition which could be non-smoking related, the repair ability of your body is compromised because of your stem cells. You weaken your stem cells, you deplete your stem cells, and there is no way that you can have efficient recovery. And that's why smoking is related with every cancer, heart disease, diabetes, high blood pressure, Alzheimer's, Parkinson's, you name it. Because these conditions grow, a normal body may be able to repair it, but a smoker's body or a passive smoker's body finds it difficult to repair it because it doesn't have the base ingredient, which is stem cells. Number 2 is heavy drinking. Heavy drinking, constant binge drinking depletes your stem cells and weakens them, which in turn gives you heart problems, liver problems, cirrhotic liver. Cirrhotic liver is nothing but a scarred liver. The liver has the inability to repair itself. It cannot repair itself because it doesn't have the base ingredient, which is stem cells. So binge drinking, heavy drinking, again, depletes your stem cells. Unfortunately, chemotherapy and radiation, in its honest attempt to kill the cancer, also kills your stem cells, which is why most patients go through pigmentation. They go through extensive pain, intensive pain in their extremities, in their fingers, and their toes, and their hands. They have spasms, they have muscle pains, and all of that stuff. That is why it is so important for you to understand that if you are doing chemo and radiation, you must make dietary and lifestyle changes. You must try to eat the foods that are good for your stem cells. Otherwise, the treatment is going to get the better of you. It may just treat the symptom, but now you're left with additional problems in the human body. So it's not that chemo and radiation is bad. It's worse if you do it without changing your diet and without changing your lifestyle. Then we have low HDL, the good HDL. In cholesterol problems, the problem is if your HDL, which is the good cholesterol, is low. Because if you have low levels of HDL, HDL acts as a good cholesterol, a scavenger that goes and cleans away all of the bad cholesterol. So it's really not an issue, your overall cholesterol, unless your triglycerides are high and your HDL is low. If your HDL is low, your body doesn't have the ability to repair your heart. It doesn't have the ability to repair the vessels, reduce the inflammation. So you may want to check your HDL levels. Diabetes. Uncontrolled and mismanaged diabetes is the #1 stem cell killer. You need to understand that when your blood sugar levels are high and out of control in your bloodstream, they are destroying your stem cells. Let me give you a simple example. Unmanaged diabetes, or diabetes which is uncontrolled, or people who don't change their lifestyles while being on diabetic medication. What happens after a while is you create so much of inflammation. Your vessels constrict. You choke the amount of oxygen and blood flow to your legs. Okay, so now your cells start to die because they don't have enough of blood flow, they don't have enough of oxygen. And now you start to get ulcers. And now because you get ulcers and wounds that can never heal, it leads to amputation. Macular degeneration of the eyes, kidney problems, and all of that stuff because of less oxygen, less blood flow, and your body cannot repair it because you don't have stem cells. You don't have the right amount of stem cells to go and heal an open wound like it would do in a regular healthy body. So people living with diabetes, please understand. You may be having good levels on your reports, but the more medication you require, you must change your lifestyle because blood sugar levels kill your stem cells. They disable your stem cells. And that is why diabetics who get wounds never usually heal from it. And your life doesn't have to be that way. You don't have to go through that suffering. You have diabetes, okay, accept it. Now, what is the root cause of my diabetes? What lifestyle changes do I need to take? What medication do I need to take to manage this so that I can reverse my type 2 diabetes? And if I have a type 1 diabetes case, which is also creating problems with my stem cells, what is the minimum amount of medication I can take by managing my lifestyle so I maintain healthy blood sugar levels? So please, diabetes is not just about your blood sugar levels. It's way beyond that. And that's why we have chronic sickness today. Millions of people living with diabetes, but also living with high blood pressure, also living with kidney disease, also living with obesity and hormonal disorders. You're still sick. You're still sick unless you address the root cause of your problem and you solve it. So nothing can get better, including heart disease. You can go on for bypass surgeries, angioplasties, and all of these things, but your body's trying to tell you something. Why isn't my heart able to heal? Why do I constantly need chronic medication? Why can't my body heal? Because I don't have stem cells. If I don't have stem cells, my stem cells usually go and repair my arteries. They repair my blood vessels. They repair the plaque, the blockages. All of that stuff that's happening is repaired by stem cells. But if you are constantly a heart patient, your body is telling you, you don't have stem cells. That should be your first priority. Take the medication that your cardiologist gives you. I don't have a problem with that. But if you're not looking at regenerating your stem cells in the human body, okay, you stay in something called chronic sickness. That doesn't have to be you. That's good for the pharmaceuticals because chronic sickness means constant medication. That's good for the medical world, but it's not good for you as a human being. You can get out of chronic illness by changing your lifestyle and working with your doctor to reduce your medication over time and preventing yourself from getting more and more issues. You shouldn't be having, as we age, we shouldn't be having more conditions. We should be having lesser conditions because we're living a healthier lifestyle. So if you have less stem cells, these are some of the problems you can expect in your lifetime. Brain injury, cognitive brain disorders, Alzheimer's, Parkinson's, dementia, heart problems, alopecia. You can take all the creams in the world and all of the steroids in the world, but your alopecia is not going to get better unless you learn how to regenerate your stem cells. You can have diabetes like we spoke about, kidney diseases, severe kidney diseases. Every cancer is related to poor stem cell regeneration. So you might have the best doctors in the world, but if you are not looking at the basics of the body, which is immunity, gut, angiogenesis, stem cell regeneration, and your DNA, even the best cancer treatment in the world is going to have only sustainable results if they have sustainable results. Then you have eye problems, you have erectile dysfunction, you have osteoporosis, basically everything. Because like I said, you're made up of stem cells. If you don't have the right amount of stem cells to fix you, okay, you are constantly going to degenerate and your health is going to degrade day by day. Now, the beauty of the foods involved, the lifestyles involved are very simple. What depletes stem cells the quickest? Chronic stress, sleep deprivation, sedentary lifestyle, overtraining with less recovery will deplete your stem cells. We spoke about smoking, we spoke about binge drinking, we spoke about all of these bad habits. Now, what are some of the most powerful foods that we can use, which are rich in bioactives, now studied medically and scientifically, that have a positive impact in helping us regenerate our stem cells?